The history of our 67-year-old male patient, past medical history significant for diabetes, hypertension, hypothyroidism, has chronic kidney disease stage 4 to 5, and suffers and is on hemodialysis. He was seen on July 8, 2015 for drainage from his left lateral foot wound. He sustained a partial amputation and he was having his fifth metatarsal snipped in the office. And as you can see on this x-ray, we have a bandage applied to the lateral aspect of the foot, and we're seeing a portion of the fifth metatarsal missing, amputated, and there's residual bone formation in the soft tissue and some type of deep soft tissue ulcer. He presented again on July 28th in the ED, and he had suffered a low impact fall. He was placed in a posterior splint and had his Lisfranc injury reduced. And on clinical exam, a blister to his right ankle was purulent and expressed from the lateral aspect of the foot. So they pressed in one location and got pus out the other location. You can see the extensive area of infection and skin dehiscence. He returns on 6/28/2016 and presents with a set of x-rays where there is plantar subluxation of the midfoot segment. And we can see, in addition, on this x-ray, this debris sclerosis disorganization consistent with a neuropathic dislocation. We can see here on the sagittal reconstructed CT a locule of emphysema, and we would have to see if the open wound was contiguous or is this on the order of a necrotizing soft tissue infection. Furthermore, looking at the frontal view, we can appreciate the degree of destruction, debris, disorganization in the patient who is suffering from neuropathic osteoarthropathy. Remember, he had a partial fifth ray amputation. We can see now further fragmentation extending to the base of the fifth metatarsal. We see the persistent soft tissue ulcer. And in addition, we see this gaseous change surrounding all of these bony structures. And that has to be further collaborated to see if there is evidence for necrotizing soft tissue infection. After an antibiotic seed treatment, this patient, you can see that there are gentamicin-laden seeds placed throughout the midfoot to try to control for some of this infection and get it stabilized and organized, ready for the patient's next stage, which will likely be an amputation of a higher level.